Assalamu alaikum guys, welcome back. Manual small incision cataract surgery, in short we can say M6, conventional extracapsular cataract surgery or CECCE, or phacoemulsification. Now these are the three types of extracapsular cataract extraction. Let's first define extracapsular cataract extraction. When I say extracapsular, that means the capsular bag is left intact during cataract surgery. Obviously the lens material is enclosed in a capsular bag, and when we make a anterior incision, there's a technique called continuous curvilinear capsular access. We make an opening in the lens capsule, we take out the lens material, and we place an artificial IOL in the same bag that is attached with the help of zonular fibers to the ciliary bodies. So there are three types of extracapsular cataract extraction, which I just mentioned, these three. The other method or technique is intracapsular cataract extraction. Now in that one, the whole bag is removed along with the lens material, and it can be done, or we use it in patients in which we have no other option, in patients which have weak zonular fibers, in which the bag cannot be sustained. So we take it out, and then we can opt for other methods like scleral fixation IOL or iris claw lens. Now that's another topic. So the three procedures which I discussed, we will be discussing them in detail, the site of incision given in these three, and the outcomes of these three. Let's discuss manual small incision cataract surgery first. Now in this one, this incision is given over the sclera. You can say about 2 mm away from the cornea, that is about 6 mm in length. And once you give this incision with the help of a crescent knife, you make a tunnel slowly and gradually towards the cornea, the anterior chamber. And once you approach the cornea, then you nick the cornea with the help of 3.2 keratome or 2.8 keratome. So you enter the anterior chamber, and then the rest of the procedure is the same. You insert the dye to stain the capsule, you do continuous curvilinear capsular access, you take out the lens material, you implant the IOL, and rest of the things are the same. Now how it differs from conventional extracapsular or phacoemulsification. In conventional extracapsular cataract surgery, the incision is given over the limbus, and that incision is large, one about 12 mm. And the difference, the advantage of M6 over conventional extracap is that this incision in M6 is self-healing and sutureless. You don't need to suture it, and it is self-healing. It will heal from time to time. So this is a big advantage. Whereas in conventional extracap, the incision you are given, you have to suture it with the help of 10-0 nylon sutures after you're done with the surgery. The rest of the procedure is the same. The only difference between them is how you approach or you enter the anterior chamber. Now these procedures are used in countries like in developing countries where they have cost issues, or they cannot afford equipment like phacoemulsification, so they opt for these procedures which are easily accessible and available. Now in phacoemulsification, the incision is also given over the limbus, but it's a very small incision as compared to conventional extracap. And from the small incision, you can easily enter the phaco probe, you can carry out the surgery. And one big difference from the phacoemulsification or from the other two is that in phacoemulsification, the nucleus is broken down and sucked with the help of this phaco probe, whereas in the other two, the nucleus is delivered with the help of pressure, and you create a pressure on the one side, and you create a vacuum on one side, or you just simply make a way for the lens material to be pulled out as a whole. Where in phacoemulsification, you chop it into pieces, into smaller pieces, then you suck it out, and that can be done with the help of this small port, as you can see in this image here. So this is a big difference, and phacoemulsification is a very advanced surgery. It's very easily, or it's also a sutureless. You don't need to suture the cornea after that. But the big problem is that it is expensive. The instrument is expensive. It is only present in developed countries or in advanced setup. So the outcome of these three, the outcome of all of these are brilliant. People enjoy their vision afterwards. They have excellent lifestyle. They have no problems after all. The only thing there in M6, the thing is that people have, when you're making an incision over the sclera, there's bleeding at that time. So the surgeon or other people usually avoid this surgery, but that bleed, it will resolve from time to time. And in conventional extra cap, the sutures that you have the sutures you have applied to suture the cornea, they will need to be removed after 45 days. So these are the two things with them. Rest of the procedure is very brilliant and patients enjoy their life afterwards. Now another point I would like to mention is that in conventional extracapsular cataract surgery, since you are cutting the limbus, making a large incision, so these people usually experience post-op astigmatism. This is one big post-op complication with that, but is not present with M6 or phacoemulsification, because in M6 the incision is at the sclera. With phaco, it's a small incision at the cornea, it's a self-healing. But in this one, since you have made a large incision, you have applied sutures, 10-0 nylon, multiple sutures, so people usually with this procedure experience post-op astigmatism. So guys, after watching this video, what is your view about these three procedures and which one you think is the best of them? Please give your opinion in the comment section, and if there are any questions on your mind that I haven't answered, please do ask them and I will try to answer them. Until my next video guys, take care.